Welcome to Champions of Care, brought to you by Oakwood Healthcare. My name is Mary Zatina. You won't believe this, but 80% of people will have significant back pain sometime in their lives. We're going to talk about that today, and most importantly, we're going to talk about some treatment options to get rid of the pain. We're so fortunate to have an expert in the studio with us. His name is Dr. Parmod Mukhi. He is a physician at Oakwood Healthcare, and he's a physical medicine and rehabilitation physician. He has offices in Southgate and also in Novi, and to further add on to his credentials, he is an assistant clinical professor for the Wayne State University School of Medicine. I'm so happy you could join us in the studio today, Dr. Mukhi.
Hi, Mary.
So I said this mouthful of a term, physical medicine and rehabilitation. That's the kind of physician you are, but what is that?
Basically, physical medicine and rehabilitation is a physician who specializes in musculoskeletal neuromuscular care, non-operative options, also doing work with head injury and spinal cord injury patients.
So say that in really simple terms.
Sure. Basically, anything related to the muscles, the bones, the joints, and the nervous system, and the function of it, that's what we do.
How all that stuff moves together.
Yes.
So today we really want to understand the back and what causes back pain, and specifically lower back pain. Can you start off very simply telling us a little bit about the anatomy of the back?
Absolutely. I actually brought some aids with me just in case. So,
great.
Basically, this is a spine model, and there are three components, and basically we start the neck portion up here, which connects to the skull, which we call the cervical spine, the middle back, or the thoracic spine, which is where the ribs come out and protect the heart and the lungs, and then the lower back, which is what we call the lumbosacral spine. And different parts that people might listen about or hear about include the discs, which is the space between the bones of the spine, and that's this clear portion right here. The nerves that come off each level, off the spinal cord, as well as the spinous process, we call it. Basically, that's what you feel when you rub up and down your spine.
Now, you physicians, you talk about thoracic, lumbar, you even have a numbering system, right? And that tracks with the three sections of the back.
Absolutely, absolutely.
So where does the lower back begin and end? What constitutes the lower back?
Well, let me show you on here. Basically, the lower spine begins where the middle spine ends. Now, that's a general term, but basically, where the ribs end, that's where the lower spine begins.
And does it go all the way down to like your hip bones, or what we call in yoga your sit bones?
Basically, it goes down to the pelvic area, or what we call the sacrum, and the coccygeal area, or the coccyx. From this point, which is each one is numbered, like you had mentioned, L1 for the highest level, L2, L3, all the way down to L5, which is a lumbar portion. And then once it switches over to the sacrum, which is this bottom portion, that's what we call the sacral part. So S1, S2, S3, and so on.
Now, what is causing all this lower back pain? What are the common causes?
Well, there's a multitude of factors, and that can be from anywhere from mechanical reasons, patients who pull their back muscle or they're doing some lifting, trauma, accidents can do it. As we get older, arthritis can sometimes start that. We can herniate a disc, and those things can cause what we call back pain.
I've heard of that herniated disc. What is a herniated disc?
A herniated disc is where one of the clear portions on the spine that I had shown to you actually bubbles out. And basically it bubbles out and it can hit the nerve or contact the nerve. And that's where we get some of the shooting pain that comes from the pain.
And that could happen anywhere in the lower back, the middle back, or the high back.
Yes, yes.
Now, what advice do you have for our viewers who are experiencing some of this pain? Do they need to know if it's lower, middle, high, or what should they do to start to address this pain?
Basically, any individual or patient who has pain, if it's a pain that just doesn't go away, it's usually a good idea to contact their personal physician or their family doctor and say, I have pain that's not getting better. And that way it can be worked up. It can be looked at to say, well, is it just as simple as a muscle that's been pulled? or is there something further going on or something more extreme going on?
And the type of physicians like you, the physical medicine and rehab physicians, do you do surgery?
I do not do surgery. We do work with the surgeons if there is a case that does require surgery to make it better.
So if someone really doesn't want to have surgery, they should maybe start their treatment of care with a physician like you.
Yes.
And do you give them why go to a physician like you if I could go to a physical therapist?
A physical therapist has to work under direction of a physician. And as a physical medicine rehabilitation specialist, or physiatrist as we call it, specializes in that kind of rehabilitation, so they can direct the care very well. Doesn't mean you don't start with your family doctor. You should definitely include your family doctor in the loop and then work together with the physiatrist as well as the therapist if that's what was recommended, and so on and so forth if further care is needed.
So there are some conservative treatment options available to us.
Yes.
Well, we're going to take a little trip. The Oakwood Champions of Care video team travels to Oakwood Heritage Hospital to learn a little bit more about pain management and a special clinic there for pain management. Let's take a look.
As a pain management specialist, we do tend to see a certain number of patients who have come to us after already trying many things to try to manage their pain. And that might be something that they've worked with another physician for some time, and either they haven't been working too well or they're hoping to get further relief. And so they often have come to us through their primary care doctor who has tried what is called the conservative treatments, which is medication management and things like physical therapy and other what we call less invasive treatments. Where a pain management specialist may come in was after a patient has tried many of those treatments and is looking to get further relief for whatever reason. Depending on the patient's actual cause for their pain, which would be determined through meeting them and perhaps investigating their back when appropriate. Certain more involved treatments could be offered. For example, some of the treatments that we do at Oakwood Heritage would be things like an epidural steroid injection and other injection treatments for the spine, which would really target their low back as a cause of pain. It would really depend on which treatment would be chosen, would depend on the individual. And that would be determined through talking to them and examining their back, and then ordering tests to try to confirm what their diagnosis is. I think one of the things that you learn when you train in anesthesiology is how to try to make patients comfortable when they're having major procedures, and that's something that attracted me to that area, to try to get involved with that, try to keep the patient comfortable. I think in terms of outcomes for patients, it really depends on the individual and their circumstances. Most chronic spinal conditions are unfortunately degenerative, so that means they do have a tendency to get physically worse over time. However, I think it's important to remember that the pain may not always get worse. Some patients would come to pain management to try to eliminate their pain completely, and as much as I would like that to occur, it doesn't always occur. However, there are a large number of patients who are left with pain that persists, and what we're able to do is to reduce their pain to a level where they can perhaps function better. What I like about pain management is the relationship with the patient and the interaction that you have with them. I've trained in pain management via anesthesiology, but I've also trained as a primary care physician, and I've worked in the emergency rooms. It was perhaps my experiences there in primary care, trying to manage chronic pain, that got me interested in alternative ways to manage the pain, and hence I've looked into pain management from an interventional approach, but also with a background of someone who likes to see patients and manage their pain depending on the circumstances with medications or other treatments. It can be very gratifying to help someone, and as I mentioned, it may be that even a small amount of pain relief is very helpful for them. And often we're not able to get rid of their pain, but we're able to reduce it so that they are happier with their outcome. And ultimately, that's what we strive for.
Dr. Mukhi, I know there are viewers who have been living with lower back pain for a long time. What would you tell them to encourage them to address that pain?
Well, first I would definitely tell them to include their family physician in any decision making. But there is a full spectrum of care from non-conservative or surgical options to conservative options, and those include medications, therapies, sometimes injections, sometimes different pain management techniques, as well as surgery. So they need to look at all those, but work with your doctor to do that.
And take some action to get rid of the pain.
Absolutely.
Well, now you're the kind of physician who a viewer could call and talk about some of those non-surgical options. Is that correct?
Correct.
You have offices in Southgate and Novi. You're a physical medicine and rehabilitation physician, and you've taught us a lot about lower back pain. So I want to thank you so much for being with us today.
Glad to be here. Thank you, Mary.
And when we return, we'll be talking with a neurosurgeon about common causes of lower back pain that can be treated with surgery. You'll want to see that, so stay with us.